So post-operatively, it's just as challenging as it is, intraoperatively, especially, for the patients. The patients have to be very cooperative and basically follow the guidelines that we tell them. So one of the things is I usually see them 3 to 5 days after surgery, and I remove the retention sutures in the office. I don't want them to shower immediately after surgery, especially when the retention sutures are there. Once I take the retention sutures, I have them wash the area a couple times a day. Just have water flow on top of their incision, with soap. I tell them I don't want them to submerge the incision in dirty water, no baths, no jacuzzis, and so on. And then the other thing I tell them is in the first 48 hours to completely lay off that area. After 48 hours, they can lay on that area, but if they're laying on it, make sure it's not a hard surface. There's cushions and it's well protected and so on. And when they do so, you want to offload after maybe every 30 minutes, just to allow blood to flow to that area and you're not compressing it. And the other thing I do is I don't immediately remove the drain or the sutures on the incision itself. It's a whole process in itself. Probably within a week or two, I'll remove the incisions, the sutures on the incision. And I don't do it all immediately at the same time. I basically evaluate and see how the wound is healing. I might take every other suture out, and then by the end of the second week, they're completely all removed. And that goes kind of for the drain as well. I assess how much is coming out, what's coming out, and usually by the end of the second week, I'll remove the drain as well.